3, 2.
Good afternoon, everyone. Thank you for joining us here today. To Dr. Heather Armstrong, the Senior Medical Officer, Dr. Michael Richmond, the CEO of Bermuda Hospitals Board, as well as Judy Richardson, the Chief of Nursing. As I've reported previously, the Ministry of Health has been working with the medical community to identify suitable locations to serve as additional vaccine centers prior to the arrival of the next batch of vaccines. This is necessary as it will allow the ministry to dramatically increase the number of vaccines we are able to administer on a daily basis and will provide residents with more convenient options to get vaccinated. Working in partnership with the Bermuda Hospital Board, I am delighted to announce that Bermuda's second vaccination center will be right here at King Edward Memorial Hospital. And this vaccination center will be where the emergency department was previously located, in the wing of the hospital closest to the Berry Hill Road. The vaccination center will initially be open Mondays through Fridays from 8 a.m. until 5 p.m. and will be able to administer approximately 200 vaccinations per day on an appointment-only basis. At this time, vaccinations will not be given to walk-ins, and the system that we currently have in place for appointments will remain in place. The current protocols require that you register your interest to be vaccinated online first. For those residents who haven't registered yet but would like to, the registration form can be found at forms.gov.bm/COVID vaccine. When you submit your registration form, you will receive an auto-generated submissions receipt. Your submission will be filed and you will be contacted as appointments are scheduled. Please remember that appointments are based on a medical risk assessment that is conducted manually by our medical team, and currently the focus is on those who are eligible in priority groups 1A and 1B, and then based on age and medical vulnerability. Every submission will be replied to, and there is no need for you to resubmit. The ministry thanks those residents who have already registered their interest and reminds residents that registering your interest does not guarantee you an appointment at this time, as all submissions will be prioritized based on the assessment by our medical personnel. And as we've stated previously, there will be sufficient vaccinations here in Bermuda for everybody who wishes to be vaccinated. I would like to thank the hardworking team at both the Ministry of Health as well as Bermuda Hospitals Board for working together to make sure that we can get the second COVID-19 vaccination center up and running quickly, efficiently, and safely, and in short order. Thank you, BHB.
Thank you, Minister. Dr. Armstrong. On behalf of the Bermuda Hospitals Board, we are very proud to be able to assist with the national vaccine effort. At BHB, we have seen the most unwell people suffering from COVID-19. 59 individuals have been hospitalized since March to our acute care units, with 7 admissions to the intensive care unit. In total, 12 people have passed. We have seen the worst this disease can do, but the solution's here if we take it. It's an amazing and potentially defining moment for us here to get access to the Pfizer biotech vaccine right now, and with enough doses to protect over a third of our community by March. It's safe, it's effective, and it's our best hope to stop the spread of COVID-19 and move on. This is why BHB is providing an additional clinic, helping increase the number of people who can get vaccinated each day in Bermuda. We are vaccinating about 150 people today, our first day, and we expect to be vaccinating about 200 people per day from this site as we move forward. The clinic will run from Monday to Friday, and we're hoping actually to extend it to Saturdays in short order. It also feels appropriate that we'll be vaccinating people in the part of the old hospital that used to house the emergency department before we had the acute care wing. It is once more a place where lives are being saved each day. We do ask anyone who comes here for vaccinations to only use the vaccination clinic entrance through the old ambulance entrance right opposite where we're standing right now, underneath the words General Wing. Enter the hospital, as the minister said, from Berry Hill. Do not come in from Point Finger Road. There are drop-off spots right in front of the clinic entrance, and please take direction from the regiment, who are kindly assisting with traffic flow. Please do not go to the main lobbies or into the hospital. You cannot access the clinic from the inside. Follow the signs or the directions from our security staff if you're lost. If you're in the wrong area, you'll be directed, but directed around the outside to the entrance. Be assured the process is running smoothly, and you do not need to come for your appointments more than 5 minutes before. We won't be able to accommodate the flow inside. The weather's cold. We've had some rain today. You can be guaranteed that you will be taken on time for your appointment. So please come at your appointed time. Finally, as we are still in a pandemic, we need to keep the footfall inside the hospital to a minimum to protect many vulnerable patients who seek care inside. So you should not access other areas inside the hospital while you're here. Thank you. Questions from the media?
So will the addition of this facility, does that accelerate your timeline, your hope for more vaccinations or 19,000 vaccinations by the end of March, or is this all part of the same plan?
This is part of the same plan. We are anticipating more vaccines to be arriving on the BA flight on Thursday evening, and in order to ensure that we best facilitate the distribution, getting more shots in arms, then the Bermuda Hospitals Board have come online to assist us with respect to ramping up the vaccination process.
Okay. Will the statistics from this facility be available more swiftly than from the other? Because right now we're getting them once a week. Will this facility be daily or fortnightly?
When we release the statistics, which we will be doing on once a week on the Tuesday press conferences, as the Premier indicated last week, the statistics with respect to the vaccination will include both this center as well as the Prospect Police Center, as well as any other vaccinations that take place. As you know, we've got vaccinations that are occurring within the corrections facility as well as the rest homes. But the statistics at this point will be released on a weekly basis on Tuesday evening at the press conference.
Is that going to accelerate because other jurisdictions are releasing them more swiftly?
As I indicated previously, at this time, we will be doing them on a weekly basis on Tuesdays at 5:45 at the press conference.
And are we anticipating the opening of more clinics like this?
All of that information will be revealed in the newness of time. We have to ensure that we are doing it correctly and swiftly. So rather than us trying to rush ahead and open up facility after facility, we need to make sure that what we're doing is properly managed and that we have the supplies chain as well as the sufficient staff to manage it appropriately.
Thank you.
Any other questions? Jonathan?
Yeah, I suppose it would be nice to hear a bit about what the mood is in the hospital staff, the level of buy-in for staff who must have been anticipating getting this.
Thank you. I think the staff are delighted that we're able to participate in this initiative. We see the negative consequences of patients getting sick. So we also know that by participating in this, we're aiding in the prevention of this disease spreading further. So I think overall, everyone's been very positive, and the multidisciplinary team effort has been fantastic.
Thanks. Can you tell us a bit about, I guess, the layout of the facility? Does it, for example, have wheelchair access?
It does. Yep, we have wheelchair access. We have, we've actually established the flow this morning so that it's going to be one way. There'll be no cross-traffic access. Unfortunately, the weather's not been in our favor this morning, but due to the fact that we are running on time, in fact, today we were running 10 minutes ahead of time, we've been able to take people in at a good click.
And you started taking people in to get their shots today?
Yes, we started this morning at 8 a.m.
Right.
Today's the first day.
You've already started vaccinating your staff to give you a flow of what's expected. What's been the flow this morning?
So thank you for that, Trevor. We had our staff vaccinations 2 weeks ago, and that was kind of a template, very well-established template for what we did today, and that was one of the reasons we were able to execute this so quickly.
Any further questions? Thank you, everybody.
Thank you.